How to know if you need PRP injections. We are going to dive into what does PRP stand for, what do PRP injections do, and number three, when do PRP injections need to be used in the rehab and recovery process? Okay, I am Dr. Corey from Choffner Rehab and Recovery, and we're helping you skyline your progress through skipping all of these things that people get stuck on because we're going to tell you what works and what doesn't work. So let's dive into it. What is PRP? What does it stand for? PRP stands for platelet-rich plasma. Okay, and those are just fancy terms for part of your blood, pretty much, right? What happens is a person produces blood, right? And what happens is they take some of that blood, it's a concentration of it, and it's called platelets, okay? Platelets are critical for blood clotting. So, and a lot of people, like say you're kind of running on pavement, you're running around your neighborhood and you fall, you slip on ice, hit your kind of knee and you scrape it and it actually opens the skin, you start bleeding. Platelets are the things that are going to help you stop bleeding. It's going to kind of clot up that area and stop it. So it doesn't kind of continuously flow, so you don't lose too much and preserves a lot of it. Okay, and that's why in people who are older, who have kind of that thinner skin, who are on blood thinners, they tend to lose these platelets and they tend to bleed and bleed and bleed, and that leads to a whole nother array of issues like low iron, right? They lose oxygen because blood carries oxygen, but we won't go down that rabbit hole. So this concentration, typically of these platelets, is injected into an injured or diseased body part, and it helps accelerate the rate of healing. And it's typically done to damage tendons, ligaments, muscles, bones, and even joints, right? So if you have like a partial tear, say like at your elbow, like a tennis elbow tear, called a common extensor tendon here, or you have a kind of tear at your ligaments, like maybe your MCL is partially torn. Typically, people have a PRP injection, and sometimes their body will produce these reparative cells, and it will kind of heal on its own with minimal to no side effects, which is the best part about it. Okay. It's not all good, right? There is some bad too, which we're going to dive into. So keep listening. Number two is what do PRP injections do? Right? The key advantage is that they reduce the need for opioids and over-the-counter anti-inflammatory medications. So anything you're taking like Advil, ibuprofen, sometimes they're giving you things like meloxicam from the doctor. There's a lot of side effects that come with those things. And it's going to kind of wear down your joints. It's going to accelerate your rate of arthritis. And that's why you shouldn't take those things because it can also destroy your stomach as well. So make sure you kind of read and you ask the doctor about any of those side effects that pop up. The good thing about PRP is that there are little to no side effects besides irritation and some soreness at the injection site, typically 1 to 2 weeks after you get the injection or within a couple days. Everyone responds a little bit differently to it. It depends on where it is and how deep it is that they're doing the injection. Okay, and the cool thing about it is because you're using your own blood, that's why there's not really many side effects. They're just taking blood out of you and putting it back in, so to speak. It's not that simple, right? They are kind of separating some things. But what this is the way it works is that they take blood out of you, like you were kind of just going to give blood at American Red Cross, or if you were going to kind of your doctor appointment and you were there for your yearly physical, if they draw your blood, right, something normal, they'll take that blood, put it in a few little tubes, they'll put it in a machine called a centrifuge, and that's going to separate the red blood cells from the white blood cells and the plasma and the platelets. Okay, so they're gonna sometimes they'll mix that with something else, and then they'll numb the injection site. So say it's your knee, they're gonna put a kind of little cream on there to kind of numb it, wait 10 or 15 minutes. And then sometimes they use an ultrasound to actually guide it. So they do it in the exact right area. Other times they'll just wing it and boom, kind of give you that injection right away. Okay. And then you're just in a waiting game to see if it's going to actually help. Some people get really good results. Some people get no results, right? So that's why it's kind of like a imbalance between kind of does it work or does it not work? There's a lot of anecdotal evidence, but there's not a lot of like pure evidence and research to support it because there's a lack of understanding on how it truly works. Okay, kind of like stem cells in a way. And that brings us into our third topic, which is how or when should PRP injections be used and how do they really kind of work, right? So what happens is the activation of those concentrated platelets in the PRP, it releases growth factors that stimulate and increase the number of reparative cells in that area and that your body produces. So what happens is this significantly enhances the natural ability of your body to heal itself. Okay, and that's why there's a limitation of side effects for it. But I will recommend that you should not just jump into PRP injections. Number one, they are not covered by insurance because there is a lack of evidence to support them. Like I said, some people get good results, some people don't. And you want to try other things first, like therapy, acupuncture, chiropractors, exercise, right? Try and do all those things with little to no side effects first. If you're not getting relief from them, then you want to move into trying PRP. So the typical progression I'll kind of tell people to follow that I've seen work really well over the 6 years I've been a physical therapist in the field is see your orthopedic doctor first if it's an orthopedic issue, right? Which most likely it is if you're watching this video. Number two is that you want to go to physical therapy next, do your 4 to 8 weeks of physical therapy that your script is going to provide you, or do it online, all right, because we do offer online. And then number three is you want to try anti-inflammatories typically, because that's going to help taper some inflammation. And if it's still not better or not improving, then you want to kind of get an X-ray or an MRI. Typically, at that point, usually an MRI is going to show you more if your PT or if your doctor's suspecting a soft tissue injury. If it's arthritis and a bone issue, you want to get an X-ray, which is a little bit cheaper and easier to get. And if it's still not improving or they don't know what's going on, or if it's a serious issue like a tear or something, and you want to avoid surgery and PT and exercise just aren't doing it, which sometimes does happen, you can't say PT works every time because it doesn't. I'd be lying if I told you that. Then you want to try PRP injections as a last resort. Okay, and they are on the expensive side. It can range anywhere from $1,000 to $3,000 depending on where you live and what they're mixing it with. Because sometimes they'll mix it with other kind of medications or like a cocktail, it's called. Not that you drink, right? Something that they'll inject to kind of help provide relief to the joints and give you kind of long-term benefit from it. So make sure you do your research. I would look up naturopathic physicians because a lot of them do it and a lot of them will do it cheaper than actually going to like a dermatologist or something like that because places are known to rip you off. So be aware of that. A lot of them charge 2 grand for one injection, which is insane because all they're doing is taking their blood out, putting it in a machine that takes 10 to 15 minutes to separate things, re-injecting it to the site. And yes, they're using a little bit of cream too, but like it should not be that expensive. It's ridiculous that it is. But yeah, that's my 2 cents on it. The other thing is people ask me a lot of times, like, what about a cortisone injection, Dr. Corey? Should I use that? Yes, you can use a cortisone injection in place of a PRP, but there are more intense side effects that come along with cortisone. So that's why I usually kind of steer people away from cortisone because people typically get one, they get a good 2 to 3 weeks of relief, then they have to get another, and then another. And typically you're limited to 3 per year because there is more intensive side effects with cortisone compared to PRP. And those side effects can range anywhere from cartilage damage to death of nearby bone, like osteoporosis, where it wears down and degrades, joint infection. It can even weaken and rupture tendons. Okay. So there are people who have known to have maybe 3 to 6 cortisone injections at their spine from studies, and then they kind of ruptured their Achilles tendon spontaneously like a year later because that side effect actually weakens the tendons. So that's something really important to consider. So make sure you weigh all your options. And before we kind of wrap up, I just want to kind of go through again, kind of that medical route that you should start with. See orthopedic doctor first, try your 48 weeks of physical therapy online or in person, take your anti-inflammatories that they give you or prescribe you, get an X-ray and MRI if it's not improving, and then if it's still not improving before you opt for surgery or anything more serious, do PRP injection and then possibly cortisone if you want to and you want to avoid surgery. Sometimes cortisone does heal it up depending on the issue. It's like a bursitis of your hip or your shoulder. Cortisone does help a lot, or if it's a frozen shoulder, it does. So cortisone can help in some situations, but there are times where it can't too, and you get too much of it and you get too kind of used to it, and too many side effects. You don't want to go down that rabbit hole. Okay, so now you know what to expect when you get PRP injections, or if you're thinking about getting it. Hopefully that was helpful for you. Again, realize this is not covered by insurance. It can be really expensive and paid out of pocket because there's a lack of understanding on how it works and there's a lack of evidence to support it. There's skewed results. One last thing I'll actually share with you is that I had a patient recently actually got a really, really good result from a PRP injection, but we literally tried everything. I treated her for about 3.5 to 4 months. She actually had a hamstring strain that it looked like because she kind of fell while she was walking down a hill during the winter here in Connecticut where it's snowy and cold. We tried isometrics, we tried PT. She came in to see me. We tried light stretching, and we saw small improvements. But every time she sat down, it would hurt to put pressure on where it was kind of. We were suspecting like a partial tear there because the strain was pretty severe and there was a actual bruising around the area. So she went through that whole medical route, saw her doctor, saw me for PT, took her anti-inflammatories. Nothing was improving after 3 months, so I sent her for an MRI. We saw there was a partial tear of her hamstring tendon where it inserts into her pelvis on the ischial tuberosity. And then what happened is she decided to get a PRP injection, and about 2 weeks later, her pain was 95 to 100% better. And I'm actually still working with her as maintenance. We're doing personal training, and she still has no pain. So it did really help her in that situation, right? I'm not saying it helps 100% of people, but for her, she got really good results with this. So it is something you guys can try. All right. So thank you guys so much for watching. Be sure to like and subscribe to our YouTube channel and at Choffner Rehab and Recovery. I myself, as Dr. Corey, help you get from 0 to 100%, and we help you return to kind of your sports, to weightlifting, to whatever you want to get back to if you're preparing for something. All you need is a phone signal and a backpack of equipment. Comment online down below if you want to learn more about our process, because we are taking new clients for the new year of 2024. And if you guys are like me, right, you want to get in shape, you want to lose your pain. I don't have pain right now, knock on wood, but I want to work on my body for 2024 and I want to get started before the new year. All right. So happy holidays, guys, and thank you so much for watching. We'll see you in the next one.